Why, thank you. Hello, everyone. I'm excited that I actually got to style my hair today. Didn't have to pull it back in a ponytail, so thank you guys. You guys give me a reason to do that. As Lise and Kayla mentioned, my name is Dr. Brandy Hutala, and I will be sharing my educational and professional journey to success as a Filipinx student. Before I start, I do want to thank again the Associated Students of GCC, Cultural Diversity, Filipino Cultural Program, and Student Equity, as well as those affiliated, including the advisors, for having me. I am honored that I get to speak for Asian Pacific American Heritage Month. So again, thank you. Oh, there you go. Okay, so first off, a little bit about me. I was born and raised in Igorok, which is known for having a very large Filipinx community. My mom immigrated here from the Philippines in her 20s, and she eventually began petitioning her siblings to come here as well. My dad immigrated here when he was 7 with my grandmother and his 3 brothers. That's me on the far left. I am the second born of 3 kids. I always like to say that I get the best of both worlds because I have a younger brother and I have an older sister, or ate, as we like to say in Tagalog. And that's a term that signifies respect for older females. Yes, I am a GCC alumna, and I graduated on the Dean's Honors List with my associate's degree. After 2 years, I transferred to UCLA, and I graduated with my bachelor's degree in sociology. From there, I went on to the Arizona School of Dentistry and Oral Health, where I earned my Doctor of Dental Medicine degree, along with concurrently earning my Master's of Public Health degree as well. Okay. I graduated from dental school in May of 2019. I just reached my 1-year mark on Sunday. And I currently practice as a general dentist in Palmdale at a community health center. As a community health dentist, we primarily serve those of low socioeconomic status. Therefore, I'm seeing a lot of patients that have rampant caries or cavities. They have severe gum disease, multiple missing teeth, and this is across all age groups. So you have infants, adolescents, adults, and among the geriatric population. It has its challenges, but it's definitely been rewarding. On my free time, I enjoy doing outdoor activities, including running, hiking, and biking with my husband and a 9-year-old dog, Luna. I also love to travel, and I love to bake. I'm starting to enjoy cooking a lot more now that I have all this free time, and I'm currently trying to learn a lot of my grandmother's recipes. All right, so before jumping into my own educational experience, I wanted to play a short clip for you guys from the comedic sitcom Fresh Off the Boat. Now, if you haven't seen or heard about this show, it's basically about a Taiwanese family that is learning to assimilate into their new suburban American lifestyle. In the clip that I'm about to play, Eddie, who is the eldest son, comes home with his grades. So let's see what happens.
Hey, Shara.
Domino, straight A's, Moms. One good thing about moving here is I have no friends and no distractions. That's why I got a... Grandma, what does Fonzie say?
Hey!
School is too easy.
Just when you think you won the game, this trick done changed the rules.
Eddie, don't call your mother a trick. You need to make school more challenging, or else my son will fall behind.
I'm sorry, there's not much I can do about a straight A student.
Well, is there extra school? Where is the closest CLC?
No. What's CLC?
Chinese Learning Center. An after-school program for reading, math, science, and violin. Look at them, the innocence. I couldn't hear them through the reinforced glass, but I imagined it was the sound of childhood. Enjoy your stick, white friends.
All right, so my parents are not as strict as Mrs. Wong in Fresh Off the Boat, but they did want me to do well in school. One concept that this scene does touch upon is the idea of Asian Pacific Americans being stereotyped as this quote unquote model minority. This construct expects Asian Pacific Americans to be studious and to attain an expected level of achievement. But as you saw, even with Eddie's accomplishments, his mom could only conclude that the curriculum was way too easy and ended up enrolling him in the CLC, which was an after-school program to undertake additional lessons. For me, I did not feel the pressure of this stereotype. I felt that this myth lumps all Asian Pacific Americans together without necessarily taking into account the differences in family attitude towards education and with family upbringing. Within my own family, education was very important, and my parents, just like any parent, wanted my siblings and I to finish with a college degree. My parents were strict in that regard, in that they wanted us to set a goal and to finish it. However, they were very supportive with whatever path we wanted to pursue, and I believe that that's in part due to my mom's own upbringing and her educational experience. In the Philippines, she actually wanted to become an engineer, but my grandfather felt that a career as a midwife would be more beneficial instead, so she started to work as a midwife before immigrating here. As a result of my mom's experience, my parents wanted my siblings and I to pursue something that we were passionate about. Therefore, school for me meant absorbing and learning as much as I could while trying to figure out what I wanted to do with the rest of my life. There was a lot of relief knowing that I didn't have this educational pressure placed on me by my parents. So it was not until I began at GCC that I came to realize my full potential when it came to education and what I could do and what I could be. I was challenged by the rigorous curriculum, by brilliant professors, and because I had been given this opportunity to earn an unparalleled education, if I so choose, that all helped to contribute to my desire to excel. This drive also had a lot to do with bearing witness to the sacrifices my parents made and all their hard work, which ultimately motivated me to be successful in my own right. So you could say that allowing me to choose my own path, that became an important aspect of my educational journey. I didn't figure out that I wanted to be a dentist until my second year at GCC. I knew I wanted to go into the health field, and so I started to explore my options. As a Filipino American, I remember being asked, why don't you just become a nurse? Now, it wasn't because I didn't want to conform to this stereotype or dismiss being a nurse in any way. I did consider it, and so I started to volunteer. But when I was volunteering, I really could not see myself in that field. Since I enjoyed both the arts and the sciences, dentistry seemed to be a perfect combination of both. Therefore, I started to shadow my own dentist, started volunteering at clinics, doing workshops, and it was really important that I immersed myself in that field as much as I could, because the more I did that, the more I really could see myself doing dentistry and enjoying it for the rest of my life. Okay, so now, regardless of how busy and overwhelming school became, one quality that most, if not all, Asian Pacific Americans share is maintaining their close-knit family ties. Therefore, family is highly valued. Staying close to family for me was definitely a priority. Therefore, once I transferred to UCLA, I commuted to West LA every day. Needless to say, I got really good at navigating my way through traffic, and this was all before Waze existed. I could have definitely lived close to campus and still see my family on the weekends, but I wanted to be at home and never thought that I was missing out on the quote unquote true or real college experience. Having the support of my parents and my family kept me focused on my goal of becoming a dentist. So now fast forward, of course, having my family and support system close changed when I got accepted into dental school in Arizona. As someone who was very family oriented, I knew that being away for 4 years would be difficult. All right, so I I'm gonna start talking about my education while in dental school. Before that, I did want to play this fun video. It was a music video I made while in dental school. It was for a debate that we had for one of our classes. We were debating different materials that we use for fillings. And so we had to create a project along with it. So we decided to do a music video. I made the music video, we did the lyrics for it. My husband, if you tuned in yesterday, he sang it. No one in my group could sing. I'm Filipino, but I can't sing. So I hope you guys enjoy.
Big Mac from McDonald's.
I got this patient in CCU4. He gets all nervous, shaking when I'm at the door. All through some city, all through my road. We're using non-people, no GI to restore. I got that etching in my pocket, got that PPE on me, got that suction ready for me when it drops. Ooh, etching dental and enamel, minding like mechanically. Forget it's golden standard, total etch. And under the lights where the amber shades go. Nowhere to hide when we're about to restore. When you edge where you already know. Straight to edge. Nothing I see better, I'm being gone. 15 seconds, rushing on you, just gone. No need for you, I want you, just gone. Ain't nobody leaving, so just keep running.
I hope you guys enjoyed that video. I'm sorry if Justin Timberlake's song Can't Stop the Feeling will never sound the same again. All right, so I didn't know what to expect when starting dental school in Arizona. My class did have a Facebook group, like all previous classes, with all 75 incoming students. And that was that allowed us to communicate and to get to know each other a little bit better prior to starting. But as soon as I got access to that page, I looked on the friends list and I wanted to see if there was any other Filipinx or Asians in my class. Since I was away from home, there would be comfort knowing that I had peers I could relate to and peers who shared similar cultural values as me. In this slideshow, I also included screenshots of what my classmates would post on our page. It really illustrates that we really helped each other out. It was not a cutthroat environment at all, and it's definitely part of the reason why I was able to thrive. Okay, so I was one of 4 Filipinx in my class, and we also had 3 half Filipinx, which was more than any other class in the history of my school. Although the course load was intense, having classmates as a support group helped to enhance my educational experience. And like I said in the previous slide, those screenshots were a good illustration of that. Dental school was difficult. I loved every minute of it, but it was met with its challenges. During our first year alone, we had a test every other day. Now that was just how our school was set up. Every dental school is different. But that's why it was so nice to have 74 other people around who knew exactly what you're going through, and you can easily turn to them for help. Like I mentioned, my class was very close. There's still a lot of people to this day that I keep in touch with. And so being able to successfully make it through is partially attributed to the close relationships I formed. It really felt like a home away from home. So after completing the didactic portion, I was finally promoted to clinic and had the opportunity to treat patients in my 3rd year of school. I was excited because I finally got to apply the knowledge and the skills I had been practicing for the past 2 years. However, I did begin to wonder how this predominantly Caucasian community and my future patients would respond to me as their dental provider, being that I am a 4'11" Filipino American with a very youthful appearance. Dentistry has also been very much a male-dominated field and profession. You know, women are slowly starting to outnumber them. In my class alone, we had 1 more female than male. But regardless of that, being in scrubs, people always assume that I was a nurse or a hygienist. In fact, on one occasion, I was at the grocery store with two of my classmates, and they were both checking out separately. We all wear the same uniform, so it's maroon scrubs with our logo on the corner. So my male friend was checking out, and the cashier asked him, he said, "Oh, do you go to the dental school down the street?" And you know, they got to talking. He's like, "Yes, I do." And then my female classmate in the same exact scrubs checks out right after him, and the cashier asked, "Oh, so are you a dental hygienist or assistant?" And I was shocked because she was in the same exact scrubs as he was with the same logo, but it just goes to show the perception of females in scrubs is not often associated with being or pursuing to be a doctor. But despite all of that, I stayed true to who I was, which is this fun-sized, not short, enthusiastic social butterfly with a very boisterous laugh that can be heard across any room. And I remained confident in myself and in my skills and made sure that those qualities really came across with every patient that I encountered. Of course, I was met with the occasional, "How old are you? You're way too young to be a dentist. How long have you been practicing?" Which, when I do get that question, I say 5 years because I count 4 years of dental school. But I didn't let the perception of my appearance interfere with my abilities. Oops, okay. So successfully getting through dental school also required balance between school and social lives. As a Filipino American growing up, I was surrounded by social gatherings practically every weekend. Therefore, I decided to become social chair of my class, along with my other classmate for our second, third, and fourth year of dental school. As social chairs, we organized social gatherings for our class, which helped to offset our busy school lives. In those screenshots, you saw that our private Facebook group was also used to post social gatherings. And in that top left pic, it's actually that was taken after our very first dental school exam back in 2015. So we wanted to commemorate the event by going to Buffalo Wild Wings and having some wings. Okay, so now I have a fun trivia game to kind of break this all up. And all you need is your phones. So I do have a prize for GCC students. So when you guys, I'll tell you in a minute how to get started, but when you guys enter your username, put GCC after your name so that I can identify you a little bit easier. But basically, you want to get your phones, go to www.kahoot.it. Everyone can play, all the viewers can play if you'd like, but the prize is only for GCC students. Okay, so we're gonna go here. And then when you go to www.kahoot.it, you're gonna input this PIN number. Anybody else before we start? Okay, I'm gonna close it in about 10 seconds. We're gonna start 10 seconds. So if you want to participate, everyone's invited to participate. Do so now. Okay. Oh, lost one. Oh, what happened? Okay. Oh, why are we losing players? Oh, if they're redoing it. Okay. Some people might be redoing your name. So if you want to redo your name, if you're a GCC student, exit out and then put in the code again. Okay, I'll give it one more minute. Okay, 30 seconds. Okay, 10, 5, okay, 4, 3, okay, 17 players, you got it? I'm gonna start, okay. So we have the first question, you're gonna answer on your phones. What percentage of Asian Pacific Americans are dentists in the United States? What percentage do you think? Yeah, 16 seconds. Okay, almost everybody's there. And all 17 answers. All right, oh, we got a lot of different answers here, but 15.7%, okay, are Asian Pacific American dentists. So who do we have on the scoreboard? We have Kahooter at the top here. Okay, we got next. What percentage of dentists are female in the United States? So what percentage? Okay, so it's 33%. So let's see where our scoreboard's at. All right, we have Erica Z from GCC at the top right now. Okay, going on to the next question. 14% of people in the United States would rather do what than floss their teeth? What would people rather do? Okay, so yes, 14% of people would rather clean the toilet than wash their teeth. Okay, next here we have, who do we have on the scoreboard? Okay, Erica's still number one, good. All right, so which United States president had several sets of dentures made from hippopotamus, cow, and walrus teeth? Which president was it? Who do you guys think it was? It was George Washington. He had several dentures made from, he didn't want fake wood ones, he wanted one from actual teeth. All right, let's see our scoreboard here. Oh, we have Kahooter back on top, followed by Erica and then Shohei. Okay, let's see next one. We have 3 more questions. In what state is it technically illegal for women to get false teeth without written permission from their husband? And this is an actual law that exists. It's Vermont. Yeah, I couldn't believe it either. Okay, so next question. Let's see where we're at. Oh, okay, next question. Okay, true or false? If you must chew gum, dental professionals encourage chewing icebreakers gum. True or false? That is actually true. Xylitol is the main ingredient in icebreakers, and basically it's a carbohydrate that bacteria can't use to metabolize to form cavities. So if you're gonna chew gum, icebreakers is the way to go, and they come in all sorts of fun flavors. Okay, so next, let's see here. Oh my God, you're on fire. One on top. Okay, next one. True or false? Tooth enamel is the hardest substance in the body. So it's that outer layer of your teeth. That's it. That's true. It's the hardest substance in your body. All right, and last question. Let's see who's there. All right, next one here. Okay, true or false? Charcoal toothpaste can help whiten teeth and make them stronger. Oh, we are very much split, but that is false. There is no evidence, no research that proves that charcoal can actually help teeth. One thing that charcoal is that it's very abrasive. And so if you use charcoal and it's very abrasive, you're actually wearing away the protective layer, which is that outer enamel layer, and making your teeth more sensitive. A lot of people don't know that the tooth color actually doesn't come from your enamel or the outer layer. It comes from the second layer of your tooth, the dentin. So you get your color from the dentin. Let's see who our winner is, or the top three. Okay, we got GCC student in third, Goodman Heidi, and Peter. Okay, so I'm assuming the first and second, and then we have Patty from GCC. First and second non-students, I'm assuming, and then Ashkay, and then Patty. Let's see.
Randy, would you want them to just submit their emails in the chat?
Yes, for the GCC students. So if you guys can give me your emails for, I'm assuming first and second were not students? Were they?
I think Manelli is one of our students, so
Okay.
I think second and third were, and then I think it was Patty as
Okay.
one of the
So if you
reps.
three will send me your emails, I will send you a virtual gift card to Starbucks in the chat. Okay, so I hope you guys enjoyed that game. I do have just a few more slides to go. Let's see. Okay, so let me get my notes back on. Okay, so I used to play Kahoot while we were in dental school, and that was just a good way of our teachers just testing us, and it was a fun way of just learning. So I will be coming up on my first year as a practicing dentist in July. It definitely feels like a huge accomplishment. Within this professional realm, it's different because I don't have professors who can bail me out if I'm struggling with the procedure. I have them as mentors that I can email occasionally for treatment plan advice or for questions, but everything I do essentially just falls on me. Growing up within a Filipinx American household, my parents always taught us that there's always room for growth and improvement. Even though I did reach my ultimate goal of becoming a dentist, now what? I am in this profession where I can truly make a difference and create positive social change. So my question to myself was, how was I going to do that? So for one thing, in order for me to continue being successful as a professional, it means that learning does not stop. I am done with school, but I need to make sure that I am staying up to date with the latest information, technology, latest tools that will allow me to better treat my patients. That's why I take continuing education courses, or CEs, Now, CEs are required for most, if not all, professionals, licensed professionals, and the amount will vary. In California, it's a minimum of 50 hours of CEs every 2 years for dentists. So a goal that I'm currently working on is to become an Academy of General Dentists Fellow, which requires 500 CEs within a 3-year period. I'm currently at 175, and there are other requirements, and this is something completely optional for dentists, but I felt like it was important for me to show to my patients that I'm actively trying to stay up to date with the information so I can better treat them. Since I do work in Palmdale, I plan on working with the public health department in the city of Palmdale to develop an oral health education program for first graders within the district. Back when I was a pre-dental, I actually volunteered for the city of Glendale in their Healthy Kids program. And I did the exact same thing. I was educating first graders on oral health. So that's why I do want to develop something very similar in Palmdale, seeing as I do see a lot of the kids there with advanced oral diseases. And for me personally, it's very important that we instill these habits in them at an early age in hopes of it carrying on to adulthood. Part of the reason why I pursued my master's in public health while in dental school was to be able to help and work with the public in that capacity. All right, so that concludes my presentation. I hope you guys enjoyed it, but I can take questions now if anybody has any.
Okay, there's a couple questions in the chat. This one is from Elise. So what were your study habits, I guess, like throughout GCC, your time in UCLA and dental school?
So I definitely went to the library a lot because for me, I didn't like studying at home because I felt like there was a lot of distractions. So I would go early, even before my classes started, and I would find a nice spot in the library and kind of just study and focus there as long as I could until my next class. That just worked for me because, like I said, a lot of distractions were at home. And that was the same at UCLA. Even though I was commuting, I would find time to just spend in the library. But if I was at home, I would find a good coffee shop and just put on my earphones and study then.
I do the same thing. This one is from Katrina. How do you respond when people ask how old you are?
Oh, so I say, oh, you never ask a woman her age. That's rude. I kind of just turn it into a joke. And I actually, one of the real responses I give is, oh, if you think I'm young, you should see my parents. And that kind of just distracts them from even wondering. But then some people are a little bit more persistent. They go, oh, but really, like, how old are you? But even then, I'm like, oh, I'm old enough. I don't give them a straight response.
That's a great way to go about it. There's a question from Marlene. What can you suggest for students who are having hard situations in studying and maybe get tired really easily?
Oh, so one thing that I would do is balance, obviously, like I said, is very important. I like working out and going for runs. So if I feel like I am just not able to focus anymore, I do some sort of active activity, whether it's going outdoors, taking a lap, walking around, just to kind of break up my studying so I can kind of feel more refreshed and focused again.
That's great advice. There's a question here from Roman. Do you know when dentists will be allowed to open up practice again?
So there's a lot of back and forth, especially with the California Dental Association and them trying to follow the guidelines from the CDC. At first, well, right now, a lot of dental practices choose to be open for emergency procedures only. So a lot of them are open for emergencies. As far as elective treatments like cleanings and fillings, that is still up in the air because of the fact that dentists are one of the ones that are higher at risk because we work in the oral cavity. So right now, they're trying to figure out how to proceed and what protocols to take, especially with COVID going on. And with the national shortage of PPEs, it's a difficult call because those obviously in the front lines that are treating COVID patients, that takes priority, them needing the PPEs more than us doing a cleaning. So as far as answering your question, they say maybe the summertime, but even then, some dental practices might not want to open yet.
Thanks so much, Brandy. There's a question here from Jira. I'm so sorry if I'm butchering everyone's names, but what was your major at GCC?
I got an associate in arts. So it was just in GEs, but in the arts.
Okay, awesome. This one is from Angelou. How are you spending your time in quarantine?
Oh, with my dog a lot, and my husband, we like to run. But my dog is getting older, so she doesn't run as much. And I'm also, like I said, I like to bake a lot, and cooking and Netflix, of course, have been the major ones.
This is from another attendee. What did you do as a GCC student to help you get into UCLA besides keeping your GPA up?
So one of the major things was volunteering. I think that a lot of things you might hear is, everyone's going to come in with high grades. How are you going to distinguish and differentiate yourself? For me, I believe it was volunteering. It wasn't just dental related. It was in other aspects that interest me as well. So definitely that helped me. Having a strong personal statement, having other people review my personal statement before I sent it also helped me, I'd say.
Awesome. This one's from Christina. Brandy, I am so proud of you. Thank you for being an amazing role model.
Oh, thank you, Christina.
I agree. This one is from Shokig. Which vitamins are good for teeth?
What vitamins are good for teeth? D, I would say, because of bones. But in terms of oral health, and because of the calcium, oral health, you want to stay away from acidic foods and just high sugary foods. So when you take vitamins, multivitamins are good for you just because it is good for your whole body. But in terms of oral health, I would say things that you should avoid is acidic food and the sugary foods.
Awesome. Thank you, doctor. This is from Patty. With such a small amount of females in the dentistry field, what are you doing to make yourself stand out?
So I think it's interesting because within my dental clinic, we're all females actually. And so it's nice because we can all kind of come together on treatment plans, and we can consult each other. There's really no males in the office. So I think working within a female-dominated clinic does kind of help differentiate me because they see all these strong females in here, as opposed to seeing there's a male dentist. I wonder if he's the lead. There's no question to it. As far as I would say that's part of the reason why I feel like I'm able to differentiate myself is just this female-dominated clinic and setting.
Awesome. Let's see. There's another question in the chat. Who was your favorite professor at GCC?
That's so hard to say because there were so many fantastic teachers that I had and professors. Professor Kamei was one of them, obviously, sociology. One of the reasons why I got into sociology. You have Professor Hazel Ramos. She was also very much enjoyable and fun. I would say those two stand out to me. But I love them all. They're all great.
I agree. There's another question that was private message to me. What was your most memorable experience at GCC?
Memorable experience. Definitely the classes and the people that I met there, who I still keep in touch with till this day. I think definitely those were my most memorable experiences because they made going through those classes fun, and it wasn't boring. So just the relationships I created.
There's a few more questions here. What were some of your biggest challenges in dental school?
So the curriculum itself was very difficult. So the way that my school was set up was our focus. So every dental school has its own philosophy and focus. Our focus was clinical because they knew that in order for us to be successful at what we did, we needed to have strong clinical skills. So our focus was making sure that we were good with our hand skills. So the way that they achieved that was having all our classes within our first year of dental school only. And then we take our first board after that. So the most difficult part was the first year because, like I said, we had a test every other day. It's like lecture, okay, you're going to be tested on it. Lecture, you're going to be tested on it. So that was definitely the most difficult aspect of it, and just trying to make sure that you're keeping up with everything and not falling behind.
That sounds terrifying.
But people make it. People do make it.
You made it. You made
It's
it.
possible. It's very possible.
There's another question here. What was the most memorable experience you had working at the public clinic that you mentioned?
Oh, okay. So I think meeting patients that are extremely grateful for what you do for them, especially with someone's teeth and their smile gives them a lot of confidence. So just being able to give their smile back to them, whether it be through crowns in their front teeth so that they have teeth there again, or whether it be dentures. So something that for me was really rewarding was just seeing their response after we had completed a treatment and then being so grateful for it.
That's so sweet. Oh, good question here in the chat. Does dentistry require a certain major?
No, it doesn't. That's why I majored in sociology. You can go into any major that you want to in order to be a dentist. The only caveat is you do still need to have all your required prerequisites. So all those bios and sciences are still required. So you can take them while you're doing and fulfilling your major. So dentistry will take any major.
That's awesome. So you did sociology at UCLA while taking just those prerequisite classes as well? Props. Wow. There's another question that was also private messaged. Do you know anyone personally that has struggled with the model minority myth, maybe in your field or any other field?
I think especially with that, I feel like in general, it's not going to be common knowledge that people are struggling with it. People tend to hide it well. But I do know of, friends of mine that have strict parents, and that school was definitely drilled into their brain and making sure that, they really did have to excel, and that, sometimes an A doesn't cut it. They wanted the A plus. So I don't know personally, but I do know of friends who did have a very strict structure like that.
I see. Next question. What was the most difficult class you've taken?
It was Dr. Mizuno's and her series of physiology, anatomy. No, Dr. Gerard's anatomy class was definitely difficult in GCC. She had this booklet, and it was very detailed. And Dr. Mizuno's microbiology. those are difficult classes.
Yeah, I've heard that from a lot of my friends. Just
They're
physio,
great. They're
anatomy.
fantastic.
Yeah.
It was difficult.
There's a question here from Angelou. What are other strengths, in your opinion, that you've acquired from your Filipinx upbringing or your parents aside from strong study habits?
Perseverance and resilience, also confidence. Uh, Actually, my parents enrolled us at a very young age in martial arts. So actually, fun fact, my siblings and I are all first degree black belts. And that was because they wanted us to be tough and to not care about our size, but to be able to stand up for ourselves. So with them, it was just being able to raise 3 strong individuals and adults.
That's great. There's there's a lot of questions that just popped up. Any advice for people who don't know what their major is yet?
I would try to explore different classes. Don't limit yourself to just one, but try to take as many as you can in different fields to try to figure out what you want to do. One thing, if you know if it's going to be health fields or not, one thing that I did was volunteer. So like I said, when I was considering different health fields, I started volunteering. So that kind of helps to give you a better picture of what you'll be doing and if it's something that interests you.
Awesome. There's a question here. How competitive is it to get into dental school?
So at the time that I applied, well, I guess it's not any different now, but I'd say it was very competitive. We had maybe taken 3% of those who applied actually got into dental school. I think there was over 2,000 applicants. I think closer to 3,000, and they took 75 students. So it's very competitive. One of the things that helped me stand out was volunteering. Like I said before, every school is different, so you just have to do your research and see what school best fits you and see if, what that school is looking for, because it's not all going to be grades. They're going to look at other aspects as well. So I would say that dental school is very competitive, even till now.
Awesome. Was that your dog in the background?
Yeah, she is.
So cute. Here is another good question. What organizations have you volunteered with?
Okay, so I did Glendale Healthy Kids. So I did that for 3 years. That's when I taught the first graders oral health education. And then I did Girls on the Run. And that was an organization that basically allowed me to work with young girls. And I was a running coach. So I actually did that for, I think it was 5 years. I also volunteered at a clinic in Pacoima, and it was a dental program there. I also volunteered in UCLA's clinic, and I did that for a few months also. So just different organizations that you can just find online, seeing what interests you.
That's awesome. We're going to take 2 more questions. So this second to last one is, if you weren't a dentist, what other career path would you have taken?
That's a good question, because I really see myself just doing dentistry for the rest of my life. I guess something fun. You know what? It's gonna be dental related. It's probably gonna be hygienist. Like to be honest, maybe teaching. I think teaching. I love young kids, and I love being able to educate them. So I say teaching.
That's awesome. You'd be a great teacher. You all taught me here today. This last question is, what advice would you give to students pursuing a career in dentistry?
That's a good question. So first advice would be to, if you're not already in a pre-dental club, to join a pre-dental club. Most universities will have one. I only say that because they offer resources for you that you would not be able to find elsewhere. For me, I uh, did not join a pre-dental club, so I had to do a lot of figuring things out by myself. So that would be one of them. I'm going to go back to volunteering because volunteering really does help. It really helps you to learn about the field that you're going to be entering. So volunteering would be another one. And to when you get to that point where you are applying for dental schools, to do your research on the actual dental school itself, because every dental school is different. When you get interviewed for dental school, it's a two-way street. You're interviewing them as much as they're interviewing you, so that you know that it's a good match for both people. And so that's one way how you'll know you'll do well there and you'll enjoy your time there, because it is 4 years and it's a huge investment. So just taking your time with making sure that you are picking the right schools.
Okay. Thanks so much, Brandy. Thanks for being here today and just sharing all your advice and your experiences as a Filipinx student. Yeah, meant a lot to us to have you here today. I'm just gonna end off with a few quick announcements. So again, if you were one of the winners for the Kahoot, just drop your student email in the chat, and then Brandy will save your email and email you your Starbucks gift card. But we also have more prizes for you. So I'm gonna go ahead and drop the evaluation form in the chat as well. Give me 1 second. So this evaluation form is if you want to enter a raffle to win a $50 gift card of your choice. And let me, sorry, I have so many sticky notes open. I cannot find the link. But yeah, just stick around. I'm going to drop that link in the chat. And then again, that form is going to close an hour after the event. So it's going to close at 2:30. So as soon as I drop it in the chat, just hop on. You're just going to have to answer a few quick questions, and then you'll be entered in the raffle. And don't forget, this isn't our last event for Asian Pacific American Heritage Month. On Friday, we have our 2 last events for the month. We have a Filipinx American sociologist coming in to speak Friday 12:30 to 1:30, Dr. Anthony C. Ocampo. And then we have the founder of Glamnetic, the magnetic eyeliner and eyelash company, coming in to speak right after that from 2 to 3. So I hope to see you guys there. And again, thank you guys so much for the support and solidarity and showing up today.